So there was a landmark study that was done by the American Heart Association, and they wanted to see if there was an association between gum disease and heart disease, or if there was a causal link. And what they actually found was they took plaque from patients that had heart disease, and in every single sample, they found PG and AA present. And we know that that bacteria came straight from the mouth. So this led the American Heart Association to make the statement that gum disease is causal to heart disease. There was a book by Bradley Bale and Amy Doneen that came out called Beat the Heart Attack Gene. It's a fantastic book for anyone that has heart disease in their family. And in that book, they quoted that 50% of all heart attacks and strokes are caused by oral bacteria and oral infection. Now, what's really important to note here is of the patients who died from a heart attack and stroke, they isolated the clots that killed those patients. And what they found is that 70% of the clot makeup was oral bacteria. So what this means is not only is 50% of all heart attacks and strokes caused by oral bacteria, but if a patient has those oral bacteria, it's going to be way more deadly. So it's really important to always get screened for gum disease, especially if you have heart disease in your family, because oftentimes it takes 10 years of having kind of, dis-ease in the body before you get an actual medical diagnosis. So during this time, you could be taking steps to improve your oral health and hopefully prevent or reverse any kind of damage that's in your heart. So what's important is that every time you go to the dentist, you should be getting a periodontal screening. So make sure that your dentist is measuring your gums with the periodontal probe, which is not everyone's favorite procedure, but absolutely necessary, because this information is going to tell the dentist or hygienist how much bone you have lost around your teeth. That's also going to be an indicator to how leaky the gum tissue is. So the bigger the pockets, usually that means that the leakier the gum tissue is, because it's in the process of breaking down. That's important because we know that bacteria will translocate from the mouth to the body in patients who have leaky gums or periodontal disease. You also want to be paying very close attention to how much your gums are bleeding. Bleeding is an indication or an indicator of inflammation. So if you are noticing bleeding gums when you wake up in the morning, or when you're brushing or flossing at night, or if your dentist is telling you that you have bleeding gums, that means that you have some sort of either oral infection, systemic ailment, or inflammation going on in your body. And that is never okay. You need to start doing some blood work, some systemic tests, or even some saliva tests to figure out what's going on in your body so that you can course correct and hopefully prevent any permanent damage.